And we'll go ahead and start with some introductions. I'm Krista Opstall. I'm the Project ECHO Director here at the North Dakota Center for Persons with Disabilities at Minot State. And Kyle, do you want to go ahead and introduce yourself?
Absolutely. I'm Kyle Erickson. I am the evaluator for Project ECHO here in Minot State.
Go ahead, Jody.
Hi, I'm Jody Patchen. I am the project support for Project ECHO at Minot State.
Hi, I'm Jessica Reiswig. I'm one of the project coordinators on Project ECHO. I'm happy to be here.
And one thing I haven't mentioned is we've actually partnered with the University of Minnesota. When we first started this series, they actually helped us figure out what our session objectives were going to be, and that was a really fantastic partnership. And the people that we worked with on that part of the project actually introduced us to Susan, Megan, and Chet. So we're really excited to have them here with us today. And I'll go ahead and stop sharing so you guys can introduce yourselves and start sharing your presentation.
Okay, well, welcome. My name's Susan O'Neill, and we're actually going to do introductions on our second slide. I want to just kind of get us started today. I think I was talking earlier to Krista that this presentation is best done probably in an hour and a half to 2 hours. So I'm going to try to get us through it in a way that doesn't feel super rushed, but kind of keeps us on point. And you may have seen that Chet threw a little chat, what we call a trickle chat request into the chat for you, thinking about maybe you guys could, we just want to get you warmed up to using the chat because we hope you're going to be engaged and we hope you're going to provide us with some of your feedback along the way so we can have some discussions. And so thinking about, your name, maybe your state or city that you're coming from, and just something that does not cost you money, but makes your day better. And I'm going to share mine, which is if I have 30 minutes in the morning to myself before work, before I have to start even my weekend chores, that just makes me so happy, makes my day so much better. And when I miss that, I really miss it. I also can't see any of your faces, so I really don't like that about these kinds of presentations, but I hope that you'll be engaged. And if you have questions, feel free to unmute as well. You don't have to just do everything through chat. We'd love to hear your voices as well. So real quick too, I want to kind of orient us. When we were first asked to do this, the idea was difficult conversations. And I asked to change the title to First Support to Employees Who Show Signs of Stress, Burnout, or Mental Health Distress, because I think it puts the emphasis on the employee. As a supervisor, you can feel really anxious about these conversations. And so you're thinking they're a difficult conversation. They may be challenging, but they don't need to be difficult. And hopefully you'll take some of that away as you think about that. You want to keep your focus on that employee. I also called them first because there are things that probably will end up in human resources that are deeper than what a supervisor can handle. And so that happens sometimes too. That's not what this presentation is about. It's not about HR functions, but it is about the fact that, yes, we're having some first discussions because we're noticing some things. There are some signs that we need to attend to. And the other thing I'm going to let you know is our area of expertise and research around workforce is in the field of intellectual and developmental disabilities. There are some slight differences to your workforce, but basically good supervision and good management and organizational design is always the same. And the workforce are quite similar in certain areas. So I'm going to keep it kind of light when we get into the workforce stuff, because it's just slightly different than what your workforce is. So we'll go to the second slide, please. All right, and so we're going to just now, I don't have Megan's picture up here, and I apologize for that. There was a little confusion, and so I just have Chet and I, but we'll also ask Megan to do a quick introduction. So much when you get to my age you could introduce about yourself. I'm going to stick to the things that are probably most relevant to today. One is that we are coming from the Institute on Community Integration at the University of Minnesota. That is our University Center for Excellence around developmental disabilities and intellectual disabilities. I've been there 28 years. Before that, I had 12 years in the field in direct support and frontline supervision. And over the time, I've done a ton of workforce stuff, developed a lot of training, lead a curriculum for supervisors as well as for direct support workers. And I worked in pulling together the first set of national frontline supervisor competencies part of that team. I'm going to let Chet introduce herself real quick, and then Megan.
Hi, everybody. Chet Cheddar. Wasn't named Chet Cheddar. My first name is really Lori, but there were 7 Loris on my floor in college, so we all took a nickname and mine stuck. I've been at the university for 5 years, and I am a workforce consultant, as well as one of the co-editors for Frontline Initiative, which is an online magazine for direct support workers. And from that, recently, we have started a podcast, since you talked about that earlier, called A Closer Look. And that is made up of authors from the latest issues to take a closer look and dig in deeper. So that's the work that I do here at the university. Thank you.
Megan.
Hi, everyone. I'm Megan Sanders. I've been at the Institute on Community Integration for about 5 years now. And I came from the workforce and I'm now a national workforce consultant. So I'm happy to be here and be with you all and learn from you all.
Okay, great. Thank you. Next slide. All right, just quick what we're going to cover today. State of stress and burnout, very lightly. You guys are living it, you know it, so we don't have to, but I'm just going to kind of reinforce maybe some things you're feeling. Proactively, what are some effective supervisor and management practices, organizational practices that support these managers? Then we'll kind of dive into what do these situations look like. We'll be clear that what are we really talking about when we talk about burnout, stress? What are the signs of it? Maybe some mental health stuff. And then we're going to talk about what's helpful from a manager's supervisor view and give you guys a chance to do these in small groups. We're going to give you some scenarios. You're going to jump into small groups, talk it through, and then share back out to the group. And we have 3 different components to that scenario. We're not covering HR processes and laws. Those are things that you need to know yourself. The other thing I want to be clear on is that supervisors are not therapists, although some of you might be licensed as therapists, I don't know, but in your role as a supervisor, what you're trying to do is support people in performance at work, also engagement, those kinds of things. Your role is not to become their life coach or their therapist. So this gets kind of tricky when their personal situations they're spilling over into work performance. This becomes a tricky place, but you really want to make sure that you're not getting into, you're kind of staying in your lane with that. And a key point of that is really not really caring about people's personal situations, but not being overly into those, and also not being judgmental. People live all different ways. So we want to make sure in our role as a supervisor, we're just handling and staying kind of on the facts. But we're not being uncaring either. We're not being so distant that we are making it seem like we don't care. The other thing you'll want to think about is if your organization has an employee assistance program, or that you just know your community. Like a lot of communities have free walk-in clinics for people experiencing mental health distress, or free health clinics, those kinds of things. It's not a bad idea to know about some of those things, because one of the key things you might do is refer people out to where they can get more assistance with something that is maybe challenging them right now. So next slide, please. And I really do want people, if you have questions along the way, please do go ahead and unmute and ask, or set something in the chat, and these guys will get it to me. So state of the workforce. We're just going to talk a little bit about the state of the workforce. Again, this is our next slide, Chet. This is our workforce, which is folks who provide direct support to people with intellectual and developmental disabilities living in community, and their direct supervisors. Those are the 2 areas where we do most of our research and most of our stuff. But like I said, a lot of this stuff is generalizable. This is some results of a survey that was done about 12 months into the pandemic around sort of the impact of that on those direct support workers. And, as we all know, any long-term service or support, whatever role you're in, it has a level of stress, and also a level of sometimes people value those roles, and sometimes they don't value them or really understand them in the ways that they could understand them. So these are kind of complicated roles that have their people enjoy them. I loved doing direct support. That was my happiest place. I like it actually even more than what I do now, and I like what I do now pretty well. But I also get a lot more recognition in the role I'm in here. So it's an interesting kind of dynamic. So some of the things that happened in this survey, this was 5,000 people in those direct support roles. These are some of the things that they were feeling. The biggest open-ended thing that they talked about was really being short-staffed. I'm sure you guys are feeling that. And so that meant they worked really long hours. Sometimes they were being sent to different locations. There was a lot of chaos around schedules. A lot of them were feeling pretty unsupported in their work, and they were experiencing burnout. They knew they were. And we know that this is still high. I think I don't have data right now post-pandemic, and I'm not even sure we are post-pandemic, to be honest. So I think what I'm seeing is kind of almost a normalization of some of this stuff. So I'm sure you guys are probably still seeing some of that in your roles and thinking about what is happening for the people that we're working with, what is happening for ourselves, and what is happening for the people we're supervising. And there are still a lot of stressors on them. Next slide, please. One of the things we always talk about, and again, may be to a lesser or greater extent, depending on your role in the long-term service and support system. But our key group, the direct support professional in IDD, really experiences sort of a lack of value. They are really not visible in the community. They are not even sometimes visible in their own organizations. And you might want to think about this with a CNA, those kinds of things, like how are you all thinking about the different folks within your organization and what their value is to the organization, and how are you expressing that and thinking that? Some of the reasons we know there are value issues are because there's just persistently low wages. They can't afford the benefits that are available to them. They don't have a lot of training or development or career advancement opportunities. And we just have such a hard time recruiting people. They don't know about these jobs, and with what they hear, they don't always like, which is too bad because the jobs can be really fantastic. And sometimes that affects care. One of the things that is also persistent, and this is a challenge in every industry, lack of good quality supervision. And that's something that can really make a difference in these things. So if a supervisor doesn't value the folks that they're supervising, that can be a challenge. But also sometimes organizational structures are not set up for that supervisor, including not acknowledging that the supervisor themselves may be experiencing burnout, stress, and mental health concerns. Next slide, please. All right, now you guys get to share some stuff with us. I'd like to hear from you guys. How do you show, or how have others shown to you, things that we do to value employees? What do we do? What might that look like? What might you see or hear or notice? How would you know that you're being valued, or how would someone know that you value them? I have a supervisor that provides one-on-one time for me every single week, and she's a very busy person. So to me, that really reflects the value for me. But if you guys would pop something in that to tell us, what does it look like to value an employee? How do we show that? Or unmute.
The company I used to work for had what they called hit bucks, but they were just paper that was specially printed for them. And then the staff could trade those bucks into like gift certificates, but it was thank yous for just simple things that the staff would do. And that was a huge reward for the staff.
And people enjoyed it. Did they feel like it was being done fairly?
I have to say, I also worked on the administrative side, so I saw many departments were giving them out a lot, where others were very conservative, but it also depended on their budget too. So like the day program, because their funding is so strict, they didn't give out as many as like the whole group homes.
Yeah, and I mentioned that because something you want to do really proactively with something like that is consider that, train appropriately the people who are handing those out to each other, because it can actually backfire, because someone can be like, I'm working harder than those guys over there, but I get none of these, you know, so you got to really be careful with how you're thinking about that. Kyle's receptive to attaboys. That's awesome. For some people, that wouldn't work at all. For some people, that would be a problem. And with all of these things, there's like, you got to think about what's working and what's not. Taking supervisees out to lunch. Yep. I actually buy happy hour appetizers once every quarter for my entire team and some other miscellaneous folks. It doesn't really cost as much as everyone thinks it does. It costs me about the same as going out to a nice dinner. And I get a chance to let the staff know I really care about how, you know, you guys, and I appreciate you. And also that it's done in a way that they actually can interact with each other. Okay, so there's lots of ways that we value each other. You guys have shared some really good things in that. I think just remembering authenticity is really important. People can tell it when you're not being authentic with them, and doesn't have to cost money, but a lot of you have put in things that are like, just really letting people know they do a good job and being very concrete about that. Because a lot of times if you just say, you know, you're doing a great job, people are like, well, what part of my, you know, what are you really responding to? But if you can really give somebody the specifics, it can help them a lot more. All right, we're going to pop on, just in the interest of time, to the next slide, please. And active listening is always really nice. Okay, we're going to talk a little bit about effective supervision and management. Again, we're doing high level stuff so that we have time for those interactions. We can go to the next slide, please. I talked about that survey a few minutes ago. Some of the things that the survey said help. So people were given a chance to say, what is helping me through this time? The first paragraph on this slide, and I believe you'll get a copy of these slides from Krista after this, is really about this whole idea that CNAs, DSPs, people in those real frontline positions are often the most forgotten. And when we talk about frontline workers, sometimes we're talking about nurses. Okay, well, they've got a fairly high level of education and prestige and all of that in the scheme of things. We sometimes forget that DSPs and PCAs, things like that, people in those roles, they need to be supported in their mental health as well. They were dramatically affected by what's happening on the ground. And so we really want to normalize thinking about self-care, thinking about them as first responders who need access to mental health support, those kinds of things. We don't want to forget our frontline workers. So that's what that first part is about. The second part is, what did the participants say? And it really boils down to, if I have flexibility in my schedule and paid time off, that makes a huge difference for me. Training and education so that I'm prepared for what I'm doing, and people showing me appreciation, acknowledging what I'm doing. Go to the next slide, please. This is a top 10 reasons why DSWs left their jobs. So that would be, again, those frontline roles. Why are people leaving? When you are in any role, honestly, you're going to be most effective if you can focus on what you have direct control over or strong influence over, right? And so I like to share this slide. Again, there's a lot of things on this slide. About half of them, a supervisor often does not have any influence or very little influence over, but about half of them, you have quite a bit. And so, for instance, number 9, a big reason people leave their jobs is the lack of supervision, time, or quality. So that, I think, is 100% in your wheelhouse as a supervisor. Some other things that supervisors have a strong influence over: poor or inadequate training, which is number 10, problems with coworkers, which is number 8, not being recognized for work, which is number 6, and no opportunity for promotion, which is number 4. So something important to think about is you do have influence over why people leave, as well as why they stay. Next slide, please. All right, so also we want to think about, how are we keeping people engaged in the organization, and what does that look like from leadership? In my mind, everybody's a leader in the organization, supervisors, managers, all the way up to the exec. And even folks that are receiving services can be a leader in an organization. So what people like to see in places where they're highly engaged is when all of those folks are focused on the mission. Everybody's mission driven. They know what they're doing, why they're there, and they can kind of keep steering in the right direction because it makes it clear what people should be doing. They also like leaders that are facilitators rather than fixers, you know, so your role is really to be a supporter, not a fixer. Your role is to ask the right questions, to bring people forward to their own thinking that helps them get to the right place, just getting barriers out of their way to their performance. So if they're spending a lot of time maybe with a new, like their computer doesn't reliably turn on, like let's just get them the right tools so that they can get their work done and that kind of thing. So, you know, those are the things, really allowing space for their best work and not telling them necessarily how to do it. They're engaging employees at all levels in organizations that are high functioning and with managers that are high functioning there. So that means you're not just talking to the other quote leaders in your organization, you're thinking about how everybody feels and you're incorporating that into the changes and into the environment to make things better. They embrace learning and change. So people want to know that their boss and their boss's boss are ready to learn themselves and are ready to take on new challenges and keep growing. But they probably don't want, the next one is the data driven. They probably don't want it always to be the flavor of the month. Like, oh, I just learned about this. Oh, I just learned about that. And then, you know, there's a lot of chaos and stuff. So also using the data driven kind of, we're going to look at this as an intervention. We're going to figure out as a team if this makes sense. We're going to make sure we have data to understand if this is working. Those are the kinds of things that inspire confidence in the employees because they know it's not just whoever's got an idea today about what's going to happen, who has the power or influence to make that happen. And the person-centeredness, we talk about it with people we support, but it's incredibly important that we're that way to everybody in the organization, including the employees. Okay, go to the next slide, please. All right. Managers' influence on employee stress. So on the flip side, a supervisor can also make things very challenging for an employee. And, you know, I talked a little bit about sort of the boundaries of this earlier. One of the things that is really important when we think about this is each employee truly is responsible for their own stress management, their understanding of whether they're burned out, their self-care. That's not our job to kind of force them to do those things. But work environment is a huge part of our lives and a huge part of our self-esteem and all sorts of things. So you want the work environment to be good for people. And if you don't make it good for people, they don't want to come to work. So some of the things that don't make it so good for people are when you're a very rigid or controlling, micromanaging kind of supervisor or manager or as an organization as a whole. Other things are not providing social support. I kind of highlight onboarding, like, you know, those, sometimes we bring people in and then we just let them sink or swim. And it's just the worst, you know, like this is a really important time to connect people to the organization and you want to keep that going. You want to make sure you're checking in with people that they feel supported enough their entire career, but especially in those first few months, because if they don't feel valued right away and clear on what they're supposed to do, they will want to run and they will look for other places to work. And we know what the marketplace is out there. They can probably find a place. Another thing supervisors can do is like just tolerating really poor behavior on the part of some employees or not handling, even sometimes say interactions with families and people supported, just kind of letting unwelcome or not okay actions continue. So you got to really take care of those things and not let them linger. And then again, not acknowledging value and contributions, sort of the backside of doing it. Next slide, please. Really important, and many organizations forget this. It's so important to make sure the supervisors and managers are supported also, and that they're hired in the right way and they're thought and recruited in the right way. As individuals, it's on you to take care of yourself. So many people come into the field of long-term services and support because they really enjoy helping others. They really want to help others. And many of them forget to help themselves, and your own robust self-care is part of the way you make sure that you're really doing this job in a healthy way. But organizations also tend to take a lot from employees without really realizing it. So managers and supervisors need that support and recognition as well. They also need to be hired with some core skills and knowledge and attitudes. They shouldn't come with nothing. They should be suited to the role. They need competency-based training that helps them know exactly how their role works in this organization. They need access to tools and resources so that sometimes what gets in the way, we think about training as being the problem, but what gets in the way for a lot of folks is really, they don't have the tools they need. They don't have the resources. And then encourage and support self-care and development there. Next slide. Okay, we're going to pop into that first support, reminding you that some of these things might move to HR functions. I would recommend whenever these situations are coming up that you are keeping a set of informal notes. They do not have to be formal, but on this date, I talked to Megan. We talked about this, very operational. You guys know how to do that, behavioral, observable, measurable kind of documentation, so that you can fall back on that and make sure that you know what you said to folks and how you handle it in case it goes into something bigger than just these conversations that you're going to have. Okay, we'll go to the next slide. So again, we're going to ask you guys in chat or to unmute signs of stress, burnout, and distress. What might that look like? What might you see or hear and notice? How would you know? What are you thinking about when you're thinking like, oh, this employee might be showing signs of stress, burnout, or distress? So using the chat or unmuting. Giving people a minute to let their fingers work. Okay, they withdraw from coworkers. Not present or engaged in the day or shift, distracted. Don't care about statements, say complaining, more sick days, physical symptoms, more sick time than usual. Yeah, these are good. These are good. So the key here that you want to remember, like, so there are things like attendance, illness, just irritability, being kind of snappy. Yeah, someone just put mood changes, sometimes tears or just very grim. Yeah, talking about all the overtime hours, how they aren't getting any rest, sort of that martyr talk starts creeping in, showing up late, not showing up at all, that kind of thing. Or being very lethargic, doing the bare minimum at work. I think it's really important that we know, though, that this is a change in behavior, right? It wasn't the way this employee always has been, because if it's the way the employee's always been, you have actually a performance issue on your hand that is different from signs of stress, burnout, or distress. So it's got to be a little bit of a change in the behavior, and you're noticing it's creeping in. It could be fast, could be slow, but it's creeping in. Okay, next slide, please. All right, so what are you to do? I'm going to kind of outline these here. You guys are going to try to think about these. Yeah, checking in. You're going to think about these things in your scenarios, okay? Like, we're going to talk about what a supervisor could do when we get to these scenarios. So I'm going to kind of go through what each of these little bullets means and some of the strategies. When I get to the regulate part, Chet just threw in the chat, what are some strategies you use for staying calm and focused in stressful situations? So you can be thinking about that already and throwing some of that into the chat. So the first thing is prevent. We just talked about that in terms of just general management, but make sure that you are not ignoring the people you supervise, not just expecting them to manage everything themselves. Support them in developing skills, know what they want to do about their personal development, and make it think about what they call psychological safety in the workplace, where it's okay to make a mistake. Be prepared for these things. Let's be honest, it's going to happen. You're a supervisor. Things are going to go wrong. People are going to have life happen to them. Happens all the time. So don't be surprised by this, and learn about your resources and recognize that these are just going to be things that happen. So be prepared for them. Be prepared to manage them when they come up. Also, if you have I like to share this, if you have a predictable situation, like for instance, I'm a guardian of someone who lives in a small group home, a 4-person group home, and they lost their entire staff minus 2 people. They had a staff of 10 and they lost everybody within a few weeks. It was completely predictable what was happening there. They could have kept those staff if they had trained and supported them properly. And so that being prepared is also like, don't let obvious things just go unchecked. You know, if you're a supervisor, you're going to have a complete turnover in who's being supported in the home. It might affect the staff and how they feel. So you want to think that through. Regulate, take it slow. So, lean in. So leaning in means like, don't think this is going away. Get ready for it. As soon as you hear it, pause and pay attention to it. As soon as you see it happening, you've got to start managing it. And it's really easy to want to run away from these kinds of things, but just the minute it happens, just lean into it. This is what's happening now, and this is my job now. That then can quickly be followed by regulating and taking slow. No need to jump to things. No need to make sure you are not amped up. I think people are sharing the things they do to take that slow and regulate. Everybody has their own things, from breathing to how they're framing things in their mind. Then you want to really ask the right questions in the right environment. So that means you do this in private, right? If you're going to start talking to people, you don't just immediately start talking to someone about a problem or a concern in public. And it's about their privacy, but it's also about reducing distractions for you. So you want to stay really clean in your own mind, that you're paying attention to this. Put your phone aside, pay attention to this. Come with true empathetic curiosity and humility and empathy. These are really important things. Don't think you know what's going on. Listen, find out what's happening. And you have to do that with open-ended questions, non-judgmental questions, trying to help somebody get there. And then after you have listened and you guys are kind of in agreement about what's happening, it's time to partner up on a plan. And when you partner on a plan with someone, one of the reasons you partner with them rather than giving them the answer is, as a supervisor, you're also developing and creating a situation where people are problem solvers and they are able to make decisions that make sense. Sometimes they need your support for that, because either just you're the gatekeeper or because that's your role, is to help them think through what they're deciding. But so you always want to invite people to, like, what is the solution? What do you think might help? And then it has to be doable. It can't be something that won't work. You know, like, I just won't come in on time unless I feel like it. Okay, that won't work for coworkers, right? So it has to be doable, something that's reasonable. And it has to be, you know, realistic, something that can really, you can really make sure can happen. You can get behind. All right. And then after that, you follow up and you learn. You don't let go of this until it's done. So usually it's not done with one conversation. You have a conversation, and again, being proactive here, you say, okay, we're going to touch base about this in a week. And the reason you're going to do that is so that they don't feel rejected, worried about their performance when you wait until there's a problem again to come back and check in with them. If you proactively check in with them, then that's just part of the deal. That's part of what you're doing. And it's a support rather than some way you're chasing them down, or, you know. So before we're getting ready to jump into the scenario, I feel like I went so fast on all of these slides.
You were right on track with timing, Susan.
Then I feel like I'm about super fast. So I'm just going to pause for 1 minute, regulate myself, and ask you all if you have any questions before we jump into the scenarios, or anything you want to share with the group. Okay, then we're going to get into the scenario. These are also going to go to at a pretty quick clip. You're only going to, basically what's going to happen here is I'm going to read the scenario. I'm going to give you some prompts. These are also going to go into the chat, and you're going to have 5 minutes to discuss as a small group. And then we're going to have 3 minutes as a larger group to come back out and just hear at least a few responses and talk about that. And then we will do that 3 times. Okay, so I'm going to start with this one, the part 1 of this. Jessica, a DSP, so direct support professional, has been coming late to the bi-weekly staff meetings for the last few months. While she used to be an energetic participant, she rarely speaks at all anymore and leaves as soon as she has the chance. Regina, the supervisor for this site, has noticed Jessica's documentation has been missing several times in the last few weeks. There have been a lot of changes lately, and Regina just doesn't feel she can handle losing anyone else. She knows she should talk to Jessica, but she feels overwhelmed. Okay, and the prompts for that are based on what we've talked about. What thoughts do you have? What would you be thinking about? What do you think Regina should do? Okay, off you go to your rooms. 5 minutes to discuss with your friends, and then we'll be back.
For those who have never done breakout rooms, Jessica's going to go ahead and get those set up, and then you'll see a prompt on your screen that says join breakout room. So it'll pop up once she gets that going. And also, this is not about Jessica Reiswig. She just messaged me. I feel so attacked.
Oh,
I said
should have
scene,
changed
not
the name.
attack.
Should have changed the name, yeah.
Krista, when they get to their rooms, will they be given like a 30-second warning or a 1-minute warning before they come back? So they know
Yeah.
to wrap up their conversation?
Yep. So we'll send a little prompt that says close, or rooms are going to close in 2 minutes, and then it'll automatically count down. So you don't have to exit right away. If you guys need to finish up some discussion, you'll see like a countdown timer, and we'll have Jody, Kyle, and I in the rooms with you guys. So you don't have to remember everything we're supposed to be talking about. It should show up in the chat though.
Weekly setting up meetings weekly, and maybe giving her extra time to work on like stuff that maybe be stressing her out, like data entry or something.
Okay. Yeah, this is great. So I want to kind of touch base on a few things before we go to the next part. One, you guys caught so many things that are really important. One thing that nobody brought up, though you may have caught it, was Regina's not where she needs to be herself, is she? She's a little bit off track. So we want to make sure that that's a warning sign for her to check in on herself. She might be neglecting some things. In fact, she knows there's been a lot of changes lately, and she's lost a lot of people. So she also needs to check in on herself. You guys really hit the part about how to kind of approach it. One thing you want to be really cautious about, and you probably is when we talk about mental health care, is we don't want to bring that in prematurely. We want the person to identify a mental health situation as their issue, and then we could connect them to resources, but we would never want to suggest to someone that they need mental health care or any other kind of care, right? They bring that up, and then we partner on how to get them there. You know, we want to make sure Regina is seeing this through Jessica's lens, which you guys really honed in on, and keeping that comfortable for Jessica. Okay, we will go to the next slide then. Okay, with support from her manager, and somebody brought that up, I think it was Jody's group. Good job. Connect to your supervisor when you're having to talk to people about performance. They should be aware of that. And also your supervisor can support you if you are feeling overwhelmed, or even just in general. So with support from her manager, Regina prepared herself and asked Jessica to come in early to a shift so they could have a talk. Jessica comes in looking nervous. Before Regina can say anything, Jessica bursts into tears and says, "Please don't tell me I'm fired," she said. "I need this job right now." So based on what we learned today, why don't you guys pop into your groups and have that discussion about what would you be thinking about? What do you think Regina should be doing? These are resource slides, so you'll be fine. I think it's important to have the discussion time. If folks are willing to share just a few things that they thought about, something, you know, that came up, we'd love it. So can someone tell us what you were thinking, what you discussed?
For time, we'll start.
Thank you.
we talked about how Regina really needs to look at herself, and maybe she is not reinforcing her staff, and she needs to look at the positive things that are going on with her staff so that they don't feel like they're going to lose their job the minute that they're called into the office. And we also need Regina to reinforce that this is not a fireable thing, that we're here to work as a group together. And Regina needs to also look to her supervisor to hash out some things with herself.
Wonderful. That's really helpful. I'm not going to ask others to weigh in just based on time, because I want to give you a chance to do the last scenario, but some great things I heard. It's interesting, the crying and the fear could be about how Regina is coming across as a supervisor, but it also could be about how Jessica is feeling about her performance, or just sort of how she sees authority figures and that kind of thing. Thank you, Angela. And so, you know, it could be a lot of reasons, but I love that you had that insight. The other thing is, you know, definitely lean in at this point. Think about physical comforts when someone's crying. So are you getting them Kleenex, maybe a cup of water, maybe a cup of tea, you know, like you know, right then you want to really help with the getting them in the right place to continue to have the discussion. Okay, we're going to go to the next one real quick and give ourselves that quick discussion about that. Regina assures Jessica that she would not fire her without warning unless there is direct cause. So you guys caught on to that. She brings her some water. She gives Jessica a minute to regain her composure. So give her the time. We do have to talk and about some performance issues, but I really want you to understand what is happening. It seems like things have been tough recently. So I want to understand what's happening. And so then Jessica says, I've been doing everything I can, but with all the changes since COVID, I'm exhausted, says Jessica. I can't get any time off because there's no one to fill in and you haven't been here except for meetings. Okay, based on what we talk about, what are the things you're going to be thinking about? Head on to your groups. You'll get 5 minutes and we'll come back, wrap it up. I'd like to give people just a few minutes to interact on this one, but if you have to go, you have to go. So I'd love to hear what you guys came up with, what you were thinking about, and what you thought Regina should be doing. One thing, oh, go ahead, Jody.
No, I was gonna say my group says that instead of just waiting until that there was an issue, maybe frequent checking in instead of, you know, just when there's an issue. Time off needs to be addressed. Why isn't she you know, you earn it, you need to take it. And be, you know, acceptable of her feelings. Like, you know, maybe Regina isn't there as much. Maybe there's, you know, supervisor issues with Regina, you know, it's just kind of going like, it's kind of like a domino effect. Mm-hmm. It could be that Regina's having a lot of issues with her supervisor and her job performance, and she's just not paying attention to her employees.
Right. And Jessica kind of passive aggressively let that be known, right? That you're not here when you should be here. Employees can't always feel powerful to give feedback to supervisors. So I'm always curious what people think Regina should acknowledge or apologize for her absences, and the fact that she hasn't been there, because sometimes that's rapport building. If you can just take your part of the problem and own it, that can build rapport. Doesn't mean it's your responsibility. Jessica's behavior is her own. So again, leaning into these difficult conversations, these things that are making us feel uncomfortable, do your regulation, continue to ask the right questions, continue to listen with empathy and humility, but then you've got a partner on a plan, right? So there's reasons why she's probably not getting her time off, that may have to do with her, may have to do with other things, and they've got to figure something out. And then really getting into that follow-up and not forgetting that. So I appreciate your guys' discussion. There would be so much more if we had more time. Let's just quick go into the resources, and then we'll if anybody who's still here has questions, we'll go ahead and answer them. Just wanted to make people aware of some of these resources. Chet talked about Frontline Initiative. That is really there's an issue on self-care for DSPs we thought would be really helpful for you guys to look at. Many of these are just kind of bigger picture things. They're not the only ones. somebody just put it, there could be reasons the supervisor doesn't have more time to be proactive and available, for sure. Still has to be handled. They need to partner up with their manager on their plan. If we go to the next slide. Chat. There we go. Something that I'm always really excited about is this wellness recovery action planning. This is a way that you look at your own wellness and health, comes out of the mental health community, something to really check out. I have a WRAP plan. If you are unfamiliar, none of you guys are social workers, so probably are not, but if you're unfamiliar with what are signs and symptoms of mental health conditions and how to kind of interact with a person and partner on the plan with them. Mental health first aid is an awesome thing to take. And this little article on how to cope with secondhand stress, another little helpful resource. And then our last slide is just really a thank you. And if there were any final questions before we go, have so appreciated you spending the time with us today. So, any thoughts or questions, and however you guys like to wrap up?
Yeah, thank you. This was a phenomenal presentation, and appreciate my breakout room and how